Hi, my name is Erin. I'm back again for a live feed today, and today we're talking about Z's, so sleeping in terms of the last day of the ABCs of PT. So in terms of sleeping, there's going to be a couple different things I touch on. Again, kind of where I talked about with my TheraBand activity last week is this is kind of dependent off of what I see with my patients, what I recommend. When it comes to sleeping, I say if you're sleeping well the way you are, don't mess with it. Sleeping can be really tough for a lot of people to actually be able to do and to be able to do without difficulty, and there's so many other sleep issues that can come up that if you have a way of sleeping, it's not bothering you in any way, please don't change it based off of what I say, because again, sleep is so important, it's so restorative just for your body in general, especially as we head into winter during flu season, but then also with any body aches and pains, it's the time when our body truly does its most restorative work to really try and help our body feel better the next day, maybe increase blood flow, and then increase any healing of any tissues that might be aggravated. So in terms, again, of sleeping, one of the biggest things that I will try and change with a patient, if we can, based off of comfort level, is sleeping on the stomach. That's usually one of the positions I don't necessarily love, just for multiple different reasons. Is not only for knee pain, just because it takes your kneecap and kind of shoves it into your knee joint. Then low back pain, it can be beneficial for certain back related issues, but then for other ones it actually can really increase your symptoms. But then also for neck pain and shoulder pain, which is usually where sleeping on your stomach can really increase and cause some problems. Particularly even if you don't just have neck pain, also for headache related symptoms, just because your neck can get cocked or turned in different positions and it's maintained for such a long period of time that too can just kind of affect or irritate more joints or more musculature in your neck. So what I'm going to go through today is just some different position changes that you can make while sleeping in bed. Again, these are ones that some of them almost seem I will say they seem kind of annoying, is if you're an active sleeper and you're rolling a lot, maybe having pillows underneath your knees or propping with you might not be the best option. But I always say you can start that way, and at least halfway through the night, if you hate it, if you're at least waking up just once, take the pillow and toss it or put it off to the side, maybe move the pillow to hug your arms. You can try a couple different things to get it out of the way. But if you're a relatively static sleeper and you don't move around a ton, using some pillows to prop to maybe help make your body stay in more of a neutral position could be beneficial and just help you wake up a little less stiff, a little less achy, and maybe with some less pain. So I have a couple different pillows here, just because again, everybody can have a little bit of a difference in pillow size just based off of your spine position. So I have this really overstuffed one here, where generally people are like, oh, I probably shouldn't have an overstuffed or a thick pillow, but there's a caveat to that. So if you generally have increased rounding through your upper back like this, when you go to lay down on your back, if you are a back sleeper, your head's going to be kind of cocked backwards, is because if I'm rounded, my head's going to want to reach back to reach the pillow, and if you can see just how everything in my neck is all jammed up, to say the least, that's going to actually lead to more pain and symptoms. So those are individuals where I would generally tend to say maybe a bigger pillow would be a better option, just to help again keep your neck in more of a neutral position, and then maybe take any strain off of the top of that thoracic spine or your upper back. So not all big pillows are a bad option. Then we have some smaller ones. So again here, these are probably more of a better option for just your general back sleeper. Because again, you're trying to look for that neutral position, trying to have your head just about as close as neutral as you can in line with your upper back. So that would be a good option for a back sleeper, again, unless you have more of that rounded in your upper back. So I'm just going to show a couple positions laying down here, and that's at least for sleeping on your back. So because I don't generally, at least at this point in my lifetime, I don't have a significant rounding in my upper back, so when I go to lay down on my back, I can just use one flat pillow, and again, just right underneath my shoulders, and it just helps me lay, again, about as neutral as I can. But again, like I was kind of demonstrating, if I'm rounded through my upper back, I'm going to be trying to reach back to that pillow, which you can just see that just looks uncomfortable. So in that situation, that's where I would use a bigger pillow. So even if I was rounded, my head can rest a little bit more soundly, and then my neck muscles can be a little bit more relaxed, and it takes some of that compression off of my spinal joints. So, but if we go back to how I am here, I'll use that small pillow. you can take a pillow and then put it underneath your knees. So let's say you have some low back aching or maybe some knee aching when your legs are straight. You can put a bigger pillow, maybe a rolled up towel, and you can put that underneath your knees just to allow your low back to just relax down into more of a neutral position. Generally, based off of how we are during normal daily activities, we were walking around, our hip flexors get tight. So if that's tight and I didn't have something underneath here, that would take my back, and this is exaggerating of course, that my back would arch up onto the table. So when you put that pillow there, you can see my back would just generally relax down more into that normal position. And again, would reduce any irritation on maybe discs, nerves, or even those joints in our low back. So that would be an option for back sleeping. So now when we talk about side sleeping, this might be where you use, again, a little bit of a thicker pillow. Is when you're laying on your side, you do want, again, we're going for at least the closest piece to neutral, or at least your neutral and your level of comfort for neutral. Everybody's neutral is different, and I think that's one of the things we're always striving for in PT is we're like, oh, you need to be a neutral spine, you need to have neutral, and neutral is good for certain people, but everybody has their own neutral and their own position of comfort. So when we're talking about side sleeping, again, you generally want to have a bigger pillow. So if you are both a side sleeper and a back sleeper though, you generally want to have like a little bit of a middle ground between the two of them. It is hard to pick a pillow when you do both, so I am both a side sleeper and a back sleeper. So I have kind of a middle ground between the two where I feel comfortable in both. But I do use multiple pillows. So I have pillows on extra beds in our house, and depending on how I'm feeling for the week or the month, if I'm feeling a little sore, I'll just grab a different pillow. Because there are different days where your body just feels different and needs different support and needs a little bit different alignment. So when you're laying on your side, I'll just show this one here, when you have that bigger pillow, it helps hold my head more right in line with my body. And then you could take another pillow and you could put it in between your knees. This one's thinner, so I would just fold it up a little bit in half to just try and keep my knees more in line with my hips. I do find this generally tends to be more of an issue for females just because of our wider hip nature, that when we have wider hips, your back is more likely to sink into the table, and then that really affects your leg positioning and the strain on your hip, where if you use a pillow in between your knees, that helps keep your hips a little bit more neutral, which then of course keeps your back a little bit more neutral. So if I were to use a thinner pillow on my neck, just to show you what that would do to my neck is, if I were to lay here completely on my side, you can see how my neck kind of cranks downward, which if I had any nerve-related symptoms, left-sided neck pain, this could just really aggravate the joints or the nerves as they come out of the cervical joint area. So that's where a bigger pillow would be a better option for this. So now one other tip that I like to give patients in terms of trying to find a good position for your neck when you're sleeping is using a towel for support. So there is a specific roll that was developed, gosh, I don't even know how long ago, and it's like a McConnell roll, where you have a roll that you can use for your lumbar, or you can use it for your cervical spine, or you can put it around your neck, and you can either tie it or attach it, or you can put it in a pillow to use while sleeping. So they are like a thicker foam roll that just helps, again, support the neutral position, or at least maintain that lordosis, which the lordosis is that just like gentle curve this direction of your neck, and because that's just where our neck is happiest, is in that position. I generally don't like to start with the roll, especially if I have somebody that has arthritis or a relatively, I won't say stiff neck, but maybe where the joints aren't moving as well or the muscles are stiff, because it almost can seem a little too thick. And again, that's my personal preference for patients. So when I am trying to start someone on a potential roll and see if it's a good option for them, I'll just start with your normal dish towel, normal hand towel, maybe even if you have headaches, or if you, now that we're getting into winter and the heat's on and your house gets a little dry, if you're kind of an open mouth sleeper, maybe you're getting congested as cold season is starting, if you're having trouble breathing through your nose, you're maybe going to extend your head back and open your mouth, and you're going to be heavy mouth breathing, which one can make your throat really dry, but also as I bend backwards again, now we're taking those muscles of the neck and kind of jamming them back together, and again causing more joint irritation. So this is where I take a towel, and I generally start small, so I will unfold it completely and just roll it up here. So generally when I have a patient use it, I will put it in a pillowcase, but just for today's purposes, just to show you, I'm gonna keep it outside the pillow. So when I go to lay down on my side again, which this works both with side and back sleeping, this pillow is okay for maintaining just that position of my neck, but as soon as I add the towel roll, there's just a little bit more cushion right in the side of my neck. So I have kind of a thin and I don't want to say longer neck, but a thin, longer neck. So when you want to generally use a smaller towel if you do have more of a thin or more petite neck, if you will. If you have a much longer neck, you might want to use a bigger pillow or even just a wider neck or a bigger pillow, bigger towel, because that will just help give you a little bit more curvature. So then you can leave that there, and then as you roll onto your back, then that helps maintain that natural kind of lordosis we were talking about, or curvature in your cervical spine as you lay here. So this does work for both, but the reason I like this is if you don't like it, you literally can just take it off and throw it underneath your bed, or take it and shove it underneath your pillow, put it on your nightstand. I generally don't like people to just throw it, because I just don't want you waking up and kind of tripping on it in the middle of the night. So that's one nice option that helps keep your head more neutral. Again, when you start sleeping like this, that leads to breathing more through your mouth, and then that can maybe aggravate some jaw symptoms or even further increase any headaches if you're having them or not having them. So those are my quick little tips for sleeping positions, and hope you have a great day.